The tooth had rotted for weeks, turning black at the root, sending waves of pain through the jaw with every breath. No pills existed to dull the agony, no appointment scheduled weeks in advance, just a wooden stool in the town square, a barber wiping blood from iron pliers, and a crowd gathering to watch. Medieval tooth extraction was public, brutal, and terrifyingly common. So how did barbers, men trained to cut hair and shave beards, become the ones who pulled teeth? And how did anyone survive the procedure without dying from shock, blood loss, or the infections that followed? Before we uncover the brutal methods of medieval tooth extraction, if you're fascinated by how medieval people endured unimaginable pain without modern medicine, hit the subscribe button and give a like. Start with the problem itself. Medieval people suffered from terrible dental health. Their diet, heavy with coarse bread that wore down enamel, honey that fed decay, and ale that added constant sugar, created perfect conditions for cavities. By age 30, many adults had multiple rotten teeth. By 40, some had none left. Tooth pain was relentless, a throbbing ache that disrupted sleep, prevented eating, and drove people to desperation. And unlike a wound you could see, or a fever you could treat with herbs, a rotten tooth offered no relief. The pain burrowed deep into the jaw, sometimes spreading to the ear or eye. People tried remedies. They chewed on cloves to numb the area. They packed cavities with wool soaked in wine or vinegar. They prayed to Saint Apollonia, the patron saint of toothaches, whose own teeth were violently extracted during her martyrdom. But prayers and cloves only delayed the inevitable. Eventually the tooth had to come out, and the person who would do it wasn't a trained physician. Physicians, educated men who studied Latin texts and treated nobles, considered tooth extraction beneath them. It was manual labor, bloody and crude, work for craftsmen, not scholars, so the job fell to barbers. Here's where the surprising truth reveals itself. Barbers were already skilled with sharp tools. They shaved faces with straight razors, cut hair with scissors, and performed minor surgeries like bloodletting and lancing boils. In medieval society, they occupied a space between common laborers and medical professionals. Guild regulations in many cities officially recognized barber surgeons, men licensed to perform small surgical procedures including tooth extraction. Their shops were easy to identify. A red and white striped pole hung outside, the red symbolizing blood, the white representing bandages. Inside, the shop smelled of soap, herbs, and sometimes the iron tang of fresh blood. A chair or stool sat in the center. Along the walls hung razors, scissors, and the tools of tooth extraction, iron pliers called dental keys, levers for prying stubborn roots, and cautery irons for burning infected gums. The barber learned his trade through apprenticeship, watching a master work, practicing on the poor or the desperate, gradually building the strength and nerve required to grip a tooth and pull. There was no formal training in anatomy, no understanding of nerves or blood vessels, just experience gained through repetition and the screams of patience. The tools themselves were terrifying. The most common instrument was the dental pelican, named for its resemblance to a pelican's beak. It consisted of a metal claw that hooked onto the tooth, and a bolster that braced against the jaw. The barber squeezed the handles together, using leverage to rock the tooth loose before yanking it out. The pelican was effective but brutal. It often crushed neighboring teeth, or broke the jawbone if used carelessly. Another tool, the dental key, worked like a modern corkscrew. The barber inserted a hook into the cavity or around the tooth's base, then twisted and pulled. This method required immense force, and patients had to be held down by assistants or family members to prevent them from thrashing. For teeth too decayed to grip, barbers used elevators, thin metal levers wedged between the tooth and gum to pry the tooth from its socket. And when infection had spread deep into the jaw, cautery irons came into play. These were metal rods heated red-hot in a brazier, then pressed against infected gums to burn away diseased tissue. The smell of burning flesh filled the shop. The patient screamed or fainted. The barber worked quickly because there was no other option. Speed was the only mercy available in a world without anesthesia. Now the critical question emerges. How did patients endure the pain? The answer is they barely did. Medieval people had access to a few crude painkillers, none of them reliable. Alcohol was the most common. Patients drank ale, wine, or stronger spirits before the procedure, enough to dull their senses but not enough to render them unconscious. Drunk patients were easier to manage than sober ones, though they still felt every moment of the extraction. Some barbers used herbal preparations. Mandrake root, henbane, and poppy were known to have sedative properties. Mixed into wine or applied directly to the gums, these plants could reduce pain slightly, but their effects were unpredictable. Dosages varied wildly. Too little did nothing. Too much caused vomiting, convulsions, or death. Most barbers avoided them, relying instead on speed and brute force. The procedure began with the patient sitting in a chair or stool. their head braced against the barber's chest or held by an assistant. The barber examined the rotten tooth, choosing the right tool. Then, without warning or countdown, he gripped the tooth and pulled. The patient's body tensed. Their hands gripped the chair. Their screams echoed through the shop and into the street outside. Bystanders gathered to watch, some out of morbid curiosity, others because public tooth extractions were a form of entertainment, a spectacle of human suffering that reminded everyone of their shared fragility. Don't overlook this detail. Not every extraction succeeded on the first attempt. Teeth broke. Roots remained embedded in the gum. Jawbones cracked under pressure. When a tooth shattered, leaving fragments behind, the barber had to dig into the gum with a narrow blade or probe, fishing for pieces while the patient bled and screamed. Sometimes the barber gave up, leaving fragments to fester and cause infection later. Other times, he kept going, tearing through gum tissue until he found the root. The patient's mouth filled with blood. They spat into a basin or onto the floor. The barber worked by feel, his fingers slick with blood and saliva, probing the socket to ensure nothing remained. If the extraction was successful, the barber packed the empty socket with cloth soaked in wine or vinegar, told the patient to bite down, and sent them home. If complications arose, a broken jaw, uncontrollable bleeding, or a patient who fainted and wouldn't wake, the barber did what he could and hoped for the best. There were no follow-up appointments, no antibiotics to prevent infection, no emergency procedures. The patient either healed or they didn't. Infection was the silent killer that followed most extractions. The medieval understanding of infection was based on humoral theory, the belief that disease came from imbalances of blood, phlegm, yellow bile, and black bile. Barbers believed that removing a rotten tooth drained corrupt humors from the body, improving overall health. They didn't know that bacteria, invisible to the naked eye, swarmed in every mouth and on every tool. Dental pliers were rarely cleaned between patients. If they were cleaned, it was with water or a quick wipe on a cloth, not enough to remove contamination. One patient's blood mixed with the next patient's open wound. Infections spread easily. Within days of an extraction, patients developed swelling, fever, and pus oozing from the socket. Some infections stayed localized, eventually draining on their own. Others spread through the jaw and into the bloodstream, causing sepsis. Victims of sepsis developed high fevers, chills, and confusion. Their gums turned black. Their breath smelled of decay. Most died within a week. Parish death records from medieval England occasionally note deaths following tooth extraction, though the true number was likely much higher because many deaths were attributed to fever or natural causes without connecting them to the procedure. The barber rarely faced consequences. Death was common enough that one more body didn't raise suspicion, and besides, the patient had chosen to undergo the extraction. The risk was understood, even if its mechanisms were not. Class differences shaped who had access to tooth extraction and how they experienced it. Wealthy patients could afford private procedures in their homes, away from public view. They paid for the barber's discretion and his best tools. They drank imported wine before the extraction and rested in comfortable beds afterward. Servants attended them, changing blood-soaked bandages and bringing broth to sip. But even wealth couldn't buy safety. Infection killed rich and poor alike. The tools were the same, the lack of sanitation universal. What wealth did buy was privacy and the illusion of control. For the poor, tooth extraction was a public ordeal. They sat in the marketplace or outside the barber's shop where passers-by watched. They couldn't afford wine strong enough to dull the pain. They returned to work the same day, their mouths packed with cloth, blood seeping through, because missing a day's wages meant their family went hungry. Some couldn't afford the barber at all. Desperate, they attempted self-extraction, tying a string around the rotten tooth and yanking, or asking a blacksmith to use his pliers. These amateur extractions were even more dangerous, often resulting in shattered teeth, torn gums, and rampant infection. Yet people tried because pain demanded relief regardless of cost or risk. The Church's role in dental pain was both spiritual and practical. As mentioned, Saint Apollonia was invoked by those suffering toothaches, and her feast day saw processions and prayers specifically for dental relief. Some monasteries kept relics, pieces of bone or cloth associated with saints, that were believed to cure ailments including tooth pain. Pilgrims traveled miles to touch these relics, hoping for miraculous healing. But the Church also shaped medical practice through its prohibitions. In 1163, the Council of Tours forbade monks and priests from performing surgery, declaring that the Church should not shed blood. This edict pushed surgical procedures, including tooth extraction, further into the hands of laypeople like barbers. It also reinforced the divide between respectable medicine, practiced by physicians who diagnosed and prescribed, and dirty medicine, performed by craftsmen who cut and pulled. This hierarchy persisted for centuries, delaying the development of proper surgical training and leaving tooth extraction in the hands of men with no formal medical education. Yet barbers developed expertise through sheer volume of practice, pulling hundreds of teeth over a career, learning which techniques worked and which killed patients. Here's the twist that changes everything. Some barbers became famous for their skill. In larger cities, a barber known for successful extractions could build a reputation that drew patients from neighboring towns. These master barbers charged higher fees, displayed extracted teeth in their shop windows as proof of their work, and trained apprentices who carried their techniques forward. A few even wrote manuals, though most barbers couldn't read or write. One such manual from 14th century France described techniques for gripping molars versus incisors, how to position the patient's head, and when to use cautery. These texts, rare and precious, circulated among literate barber surgeons and eventually influenced early dental practices. But for every skilled barber, dozens more were incompetent or reckless, men who took up the trade because it paid better than manual labor and required only a basic set of tools. They learned by trial and error, and their patients paid the price. Still, even a bad barber was better than no barber at all when a tooth rotted to the nerve and pain made life unbearable. The psychological toll of tooth extraction extended beyond the physical pain. People who had teeth pulled often developed a terror of barbers that lasted the rest of their lives. Children who watched their parents undergo extraction grew up fearing the same fate. This fear was rational. The procedure was traumatic, the pain indescribable, the outcome uncertain. Yet tooth decay was inevitable for most people, which meant the cycle repeated. A person might have 3, 4 or more teeth extracted over their lifetime, each time returning to the barber's chair with dread. Some chose to live with the pain rather than face extraction again, letting teeth rot in their mouths until infection forced action. Others became numb to it, treating tooth extraction as an unfortunate but routine part of life, like childbirth or winter fevers. This normalization of suffering shaped medieval attitudes toward pain in general. People endured agony because they had no choice, and that endurance became a kind of virtue, a test of character. The ability to sit still while a barber wrenched a tooth from your jaw demonstrated strength, and survivors wore their missing teeth as badges of survival. By the late medieval period, some cities began regulating barber surgeons more strictly. Guilds required apprenticeships, examinations, and licensing fees, attempting to weed out the most incompetent practitioners. London's Barber Surgeons Company, established in 1368, set standards for tools, training, and conduct. Members who killed patients through negligence could lose their licenses, though proving negligence was difficult. These regulations improved quality slightly, but couldn't solve the fundamental problem. Without anesthesia, antiseptics, or an understanding of infection, tooth extraction remained a dangerous gamble. The improvements that eventually transformed dentistry, sterilization, local anesthesia, X-rays, came centuries later, built on scientific advances that medieval people couldn't imagine. Yet the barber surgeons laid the groundwork. Their hands-on experience, passed from master to apprentice, created a body of practical knowledge about teeth, jaws, and the human body's resilience. They weren't scientists, but they were survivors, men who did brutal work because someone had to. The legacy of medieval tooth extraction lives in our modern dental anxiety. Even today, with painkillers and numbing agents, many people fear the dentist. That fear traces back through centuries to a time when tooth extraction meant sitting in a public square, biting down on leather, and screaming while a barber pulled with iron pliers. We've conquered the pain, the infection, the risk of death, but the memory lingers in our collective consciousness. Every sterile dental office, every gentle reminder to floss, every routine cleaning is a victory over the medieval reality where a rotten tooth could kill you, and the only solution was a man with no medical training and a set of blood-stained tools. Medieval people survived tooth extraction not because the procedure was safe or humane, but because they had no alternative. Their courage, or perhaps their desperation, reminds us that what we consider basic healthcare was once a life-threatening ordeal, and it shows us how far we've come, and how recently, in the long history of human suffering. If you enjoy the hidden sides of medieval life, hit subscribe and give this video a like.